highest in North Karnataka. And today, we celebrate another historic milestone, the establishment of the National Reference Simulation Center. The center, only the second in India and the first competency certification center registered by the Indian Nursing Council. The inaugural stone has already been unfolded and revealed. As we begin this significant occasion, I humbly request all our esteemed delegates to kindly take their seats on the dais, requesting the faculty to kindly escort the dignitaries onto the dais. Prayer is a spontaneous urge of the heart. It's a simple glance turned toward heaven. These words remind us that prayer is not merely a ritual, it's a moment of inner stillness, a gentle lifting of the heart to the divine. Ladies and gentlemen, I now request Navya and the team to lead us all into a moment of praise. Thank you for that soulful evocation. Ladies and gentlemen, may I now request all of you to please rise and join us in paying our respects to the state of Karnataka by singing the state anthem, Jai Bharata Jananiya Dhanujati, requesting everyone to please rise. Thank you. You may kindly be seated. To formally open today's proceedings, it's my honor to invite a distinguished leader, an academic visionary and the guiding force behind the excellence of Sajrashri Institute of Nursing Sciences. Ladies and gentlemen, please welcome Dr. Dilip S. Natekar, Principal, BBBS Sajrashri Institute of Nursing Sciences, Bagalkote, to deliver the welcome address. So, the gathering is eager to hear your words of greeting and inspiration.
Ladies and gentlemen, a very warm and respectful good morning to one another. It's my honor and privilege to extend a heartfelt welcome to each one of you to this historic and momentous occasion. The inauguration of the National Weapon Simulation Center, the Competence Certification Center, and the International Sun Conference hosted by V.V. Sangha Sajrashri Institute of Nursing Sciences, Bagalkote. Today marks a landmark day in the educational journey of V.V. Sangha and in the advancement of nursing education in our country. The establishment of this world-class simulation and competency training facility is the realization of the visionary dream to prepare high-skilled, practice-ready, and globally competent nursing professionals. In today's healthcare environment, nurses must be confident, competent, and prepared to handle complex situations. Simulation-based education has emerged as a transformative solution, offering a safe, realistic, and advanced clinical training without risking the real life. This center stands as a testimony to V.V. Sangha's commitment to innovation and excellence and global standards in the nursing education. We are honored to have among us an extraordinary consultation of visionary leaders, global experts, academic pioneers, and respected guests who have made this day possible. First and foremost, I extend a special and devotional welcome to the President of this function, Dr. Veerana C. Charantimar sir, Honorable Chairman of BV Sangha, and the towering leader whose foresight and guidance and relentless commitment have been the driving force behind this remarkable endeavor. Sir, your unwavering support and passion for education excellence have transformed countless institutions across Bagalkote, Karnataka, and in many parts of India. Today's milestone stands as yet to another shining example of your vision. We are deeply honored by your presence. Sir, on behalf of my own self and all of us, I extend a respectful and gratitudinal welcome to you, sir. It's my privilege to warmly welcome Dr. T. Dilip Kumar, President of Indian Nursing Council, New Delhi, and Board Member, International Council for Nurses, Geneva and Switzerland. A dynamic, visionary, and transformational leader who has dedicated his life to strengthening of nursing profession in India. Sir has been instrumental in advancing competency-based nursing education across the nation, ensuring that every nursing graduate is skilled, confident, and globally competent. His leadership has redefined national standards and paved the way for a stronger, future-ready nursing workforce. We are deeply grateful for his enormous contributions. Of course, his work has been globally recognized. The result is Royal Presidency of Thailand has confirmed the highest civilian award for achiever in health field, that is Princess Srinarendra Award. Sir, I hope you remember it was during your visit to Bagalkote in 2022 for the National Conference on Empowerment of Nursing Profession to empower nursing leaders and clinical research. You planted a seed of establishing this world-class center in our minds. Now that seed has blossomed into a proud reality because of generous support and interest of our proud chairman, Dr. Veerana C. Charantimar sir, in advancement of nursing profession. Sir, we are truly honored by your presence with us. On behalf of my own self and BVV Sangha, I extend a red carpet welcome to you, sir. A respectful welcome to Dr. Bhagwan B.C. sir, Honorable Vice Chancellor of Rajiv Gandhi University of Health Sciences, Bengaluru, whose academic leadership continues to inspire excellence across all health sciences institutes in Karnataka. Under his dynamic leadership at RGHS, several progressive policies are being introduced to enhance the curriculum quality, streamline examination, and promote research culture among faculty and students. Sir, I am sure that your tenure will be remembered for the initiatives that will surely improve the healthcare and academic integrity. I also take this opportunity to mention your special concern about nursing profession. Sir, on behalf of my own self and BU Sangha, I extend a warm welcome to you, sir. A warm and heartfelt welcome to Dr. Kamlesh Lalchandani, Deputy Country Director, Chicago, a global partner in strengthening nursing and midwifery initiatives and strong supporter of this endeavor. Sir, I extend cheerful welcome on my own behalf and BU Sangha to you, sir. It's my pleasure to welcome Sri Sanju Singh, Managing Director, Ladder Medical Private Limited, India, whose organization has been global leader in simulation-based learning and key collaborator in establishing this center with cutting-edge technology. Sir, I extend warm welcome on my own behalf and BU Sangha to you, sir. A heartfelt welcome to Sri Mahesh N. Atri, sir, Honorary Secretary, BU Sangha, and Sri Ashok M. Sajjan Dev Sir, Chairman, Governing Council, BU Sanghas, Health Sciences Institutes, Bagalkoti, leaders whose commitment to the Sangha continues to shape its success. On behalf of my own self and all of us, I extend warm welcome to both of you, sir. I extend respectful welcome to Dr. K. Reddamma, Nodal Officer, National Consortium for PhD Nursing and most respected personality in nursing fraternity. Madam, I warm welcome to you. I welcome Dr. Manju Vatsara, former Principal, AIMS New Delhi and Senior Consultant of Indian Nursing Council. Madam, I happy welcome to you. We are honored to welcome the most respected executive committee members of the Indian Nursing Council, Mrs. Lal Devi Singh Madam and Mrs. Sunita Chaudhary Madam. I extend warm welcome to Colonel Dr. Sarojit Kaur Madam, Secretary Indian Nursing Council, New Delhi. Hearty welcome to you, madam. I take this opportunity to welcome most respected senior consultant and former joint secretary of Indian Nursing Council, Dr. K.S. Bharti Madam. Madam, I warm welcome you. I also welcome one more senior consultant of Indian Nursing Council, Sri H.M. Reddy sir. Sir, I warm welcome you. We are deeply honored to host eminent international and national faculties. Madam Carrie Hamilton from United Kingdom, Madam Laura Smith from Singapore, Mr. James Naismith from Australia, Mr. Alvin Tong from Australia, Madam Lucy from London Medical Private. And we have traveled across the world to be with us today. I am sure your presence will enrich this conference and strengthens the global academic collaboration. I wholeheartedly welcome all of you to this meaningful gathering. We are very fortunate that today we have with us, I extend a hearty welcome to Sri Samir Kumar Janna, IAS Sub-Collector, Orissa. I extend a welcome to all the state and national leaders, our respected principals of various nursing colleges of Karnataka and across India. I extend respectful welcome to dedicated members of BU Sangha and also extend a warm welcome to our Senate and Syndicate members of Rajiv Gandhi University and also extend special on behalf of BU Sangha and Sajjan Institute of Nursing Sciences. I extend my warmest greetings to you all. Thank you for your presence, your encouragement and your shared commitment to strengthening nursing education in India. With a great pride and joy, I welcome you all to this inaugural ceremony and international conference. Thank you one and all. Have a great day.
Thank you, Dr. Nadikar, for that warm and gracious welcome. I now request Dr. Shambhavi to present Dr. Nadikar with a token of welcome.
I forgot to welcome a press and electronic media. I welcome to all of you.
A warm welcome to you as well, sir. Ladies and gentlemen, every auspicious beginning is marked by the ceremonial lighting of the lamp. Astoma Sarkamaya, Tamasoma Jyotirgamaya, Mrityoma Amritangamaya. Lord, guide us from ignorance to knowledge, darkness to light, and mortality to immortality. I request all the dignitaries to kindly proceed to the lamp for the ceremonial lighting. May this light guide today's event and illuminate the path of learning for all generations to come. Thank you, dignitaries, for gracing us with the lighting of the lamp. Ladies and gentlemen, as we celebrate the inauguration of this pioneering National Reference Simulation Center, it is important to recognize the partners whose expertise and support have made this center a reality. At the forefront of this collaboration is Lateral Medical Private Limited, New Delhi, the renowned provider of advanced simulation technology and equipment that forms the backbone of NRSC. The world-class solutions they have enabled us to create highly realistic hospital environments for training competent nursing professionals. It is now my honor to invite Mr. Sanjeev Singh, Managing Director, Lateral Medical Private Limited, New Delhi, to address the gathering and give the preamble note on the Simulation Center. Sir, the floor is yours.
So much, sir. Honorable Chairman, sir. Honorable INC President. Honorable Vice Chancellor, sir. It is an extreme pleasure to be part of this wonderful, wonderful conference, plus the inaugural ceremony of this much awaited simulation center that has come up, which is not going to provide just the high quality training to the nurses, but to improve the overall healthcare ecosystem of the country and state. As a company, it is our pleasure to be part of this wonderful galaxy. The whole purpose of this International Sun Conference is to bring people together, give them the platform to discover the values and the golden nuggets of the simulation, and unite with the community and explore this whole beautiful world of simulation. As we are moving forward, and this has been said multiple times in the past, the nursing is the backbone of any healthcare system. And under the leadership of INC President and Honorable Chairman Sir, this has been the great moment where the nurses and the healthcare system will get beautiful environment and very, very safe environment for the practicing for the nurses. I am sure the world is looking towards India. The human resource, India is going to be the human resource capital, and it is our endeavor that the human resource that goes out of India and stays inside India is a very, very high quality. And I'm sure this center will work towards that direction. Lateral India is fully committed to bring this up in the most efficient, the best manner. Thank you so much.
Thank you, Mr. Sanjeev Singh, for sharing your insights. Ladies and gentlemen, the The establishment of NRSC has been made possible not only through cutting-edge technology, but also through the generous and steadfast support of our esteemed partners. We are deeply privileged to have had the enduring and selfless support of Chicago Newton, right from the very inception of the idea in 2023. Their commitment to advancing healthcare education and nurturing competent nursing professionals has been truly invaluable. It is now my honor to invite Dr. Kamlesh Lalchandani, Deputy Country Director, Chicago Newton, to address the gathering. So the stage is yours.
Thank you. Good morning, everyone, and respected people on the dais. I think this is a historical moment, and as a public health professional and someone who is working in this field more than 15 years as a part of the JAPIGO, this is a proud moment of us, and I think we are thankful to Indian Nursing Councils that we are working in collaboration with INC and LADL for establishment of the second NRSC. And again, it's going to the next level because we are part of the establishment of the first National Simulation Reference Center that is in the Gurgaon in the University. But when he arrived, because this was my first visit, but when he arrived, it was beyond expectation. And when I was talking to Bharti from INC, that we never imagined that I was just hearing from the intro, we supporting this initiative from the PIGO. But definitely since morning, the infrastructure, what I have seen, the commitment from the leadership, commitment from the owners, because they haven't compromised the quality. It's very difficult to get, and Dr. Dilip always says that many people are coming to me, but some people that we do this, but no one says whatever you will do, it will be done. And this is the institute where I think they have delivered the expectation. As a partner, we are technical partner. We bring the technical expertise, but investment, it needs a lot of investment to build this kind of infrastructure and lots of commitment. So my heartful thankful to the leadership and all the society members. Why this is important? So I would just think because healthcare needs are changing. If you see India's demography, life expectancy is increasing. And then because of this, the many chronic condition prevalence is increasing. Either it's a heart disease, a mental disease, and the digital technology is coming up the big way. And this in this complex environment, the role of nurses is very important. So the demand is changing, market is changing. So if we have to go and we have to adaptable, we have to come up with these newer initiatives for the teaching methodology. And for that, I think National Simulation Reference Center, it's a way forward. And even if you see currently in all BSc curriculum or the medical curriculums, it's a competency-based education. We always say, now it's a competency-based, and national dialogues is also shifted. Now all of them are talking about the competency-based education. And what the solution for this? It's a simulation, is the solution for this. Even if you see Western countries, all the global countries, all the medical education, nursing education are on the simulations, are on the high fidelity mannequins. Because in India we get so many clients, but for students working in the safe and safety environment, simulation is the way forward. Another thing which this center brings is the competency certification center. And again, if there's next NMC is coming, this is going to be very important. Where all the nursing staff, along with this skill base, they should be assessed, they should be certified. Even you are aware that many nurses are going abroad, right? They all have to go through all these OSCEs and certification centers. If in India, if we can create this kind of certification centers, I think this will help this Indian workforce not only work in the India also, but for the abroad also. And there are very few centers, so definitely we are looking forward for these centers. We are deeply committed to support technically whatever we can do. Thank you. Thank you.
Thank you, sir, for your support and encouraging words. Ladies and gentlemen, we now arrive at a moment of historic significance in the journey of National Reference Simulation Center, a milestone that formalizes the collaboration between visionary institutions and partners dedicated to advancing nursing education in India. A few years ago, when Dr. T. Dilip Kumar, President of Indian Nursing Council, visited Sajjalashri Institute of Nursing Sciences, he was profoundly impressed by the capabilities of the institution and the unwavering support of BBB Sangha. He immediately recognized that this institution possessed the vision, commitment and infrastructure to establish the second NRSC in India. It was in that very moment that Chairman Dr. Veerana C. Charanthimar took a decisive visionary step to make this aspiration a reality. A bold decision that he saw through with determination and exemplary leadership. Today, we witness the fruition of that vision. I now invite the representative dignitaries to come forward for the signing and exchange of the Memorandum of Association between BBB Sangha, Indian Nursing Council, Japaico, New Delhi, Ladin Medical Private Limited, New Delhi. This signing is not merely a procedural formality. It is a symbol of foresight, collaboration, and excellence. And we are privileged to be a part of this historic moment in the advancement of nursing education in India. Ladies and gentlemen, let's clap and congratulate as we witness this historic moment happening. This moment strengthens the bond between the partners, wishing prosperity to NRSC. Ladies and gentlemen, on this momentous occasion, it is our profound honor to felicitate a visionary whose guidance and insight have made a landmark initiative possible. Dr. T. Dilip Kumar, President of the Indian Nursing Council, New Delhi, and board member of the International Council for Nurses, Geneva, Switzerland. Dr. Dilip Kumar is a profile of determination, dedication and achievement. His unwavering commitment over 49 years to the advancement of nursing education and professional excellence has elevated the profession in India and earned global recognition. This felicitation by NRSC and Sajjalashri Institute of Nursing Sciences, Bagalkot is a tribute to his foresight and vision. Indeed, Dr. T. Dilip Kumar is a man of the hour, but along with him, we will be felicitating his pillar of strength, his spouse, Mrs. Kaushalya Dilip Kumar. I request the faculties to kindly escort her onto the desk for the felicitation. The VDV Sangha now takes immense pride in honoring Dr. T. Dilip Kumar, a global ambassador of nursing, a man whose vision, dedication and relentless pursuit of excellence have transformed his profession. We are also privileged to have with us the woman behind Dr. Kumar's success, his beloved better half, Mrs. Kaushalya. The Sangha takes pride in honoring her for being a constant support in her husband, Dr. T. Dilip Kumar's pursuit. Today, VVV Sangha is especially proud to felicitate him for receiving the Princess Sri Nagarendra Award at the Thailand Palace, the highest civilian honor in Thailand for nursing excellence, and for his recent election as board member of the International Council for Nurses Southeast Asia region, Geneva, Switzerland. This recognition not only celebrates his lifetime of service to nursing education, but also reflects far-reaching impact of his visionary leadership. It is indeed an honor to have you with us today, sir. Thank you, dignitaries, for doing the honors. Pardon me. Thank you, Mrs. Ahilya, for joining us with us today. Ladies and gentlemen, on this momentous occasion, it's a profound privilege to felicitate our chief guest, a distinguished academician, visionary leader, and exemplary surgeon, Dr. Bhagwan B.C., Honorable Vice Chancellor of Asia's largest health science university, that is Rajiv Gandhi University of Health Sciences, Bengaluru. Dr. Bhagwan's stellar career as a surgeon, educator and administrator is adorned with numerous accolades and fellowships, including FRCS Edinburgh and Glasgow, the Varita Ratna Award, the Dr. B.C. Roy Award, multiple national and international honors recognizing his extraordinary contribution to healthcare. Thank you, dignitaries. At this landmark occasion, we are honored to felicitate a distinguished public health leader, Dr. Kamlesh Lal Chandani, Deputy Country Director, Japayo, New Delhi. With over 2 decades of experience in managing large-scale healthcare programs, leading diverse teams, Dr. Lal Chandani has been instrumental in driving high-impact initiatives across maternal and newborn health, family planning, reproductive health, and non-communicable diseases. At Japayo, he champions data-driven decision-making, shaping national policies, and guiding sustainable healthcare solutions. We are honored to have you with us today, sir. Here we honor the true champion of healthcare and public service. We now take a moment to honor a leader whose contribution has been pivotal in elevating simulation-based medical education in India. Mr. Sanjeev Singh, Managing Director, South Asia Ladder Medical Private Limited, New Delhi, brings over 20 years of expertise in high-end diagnostics, medical devices, healthcare IT, and strategic healthcare solutions. His vision spans business growth, new technology introduction, talent development, and building a strong partnership that support Ladder's global mission in helping save lives. Thank you, sir, for your gracious presence today. Ladies and gentlemen, it is truly an honor and a rare privilege for Tertiary Institute of Nursing Sciences to host the esteemed executive committee members of the Indian Nursing Council, an honor that no other nursing college in the country has been bestowed with. With immense respect, we now extend our heartfelt invitation. Ladies and gentlemen, we will continue with the felicitation after a short while. It is my honor to invite our chief guest, Dr. Bhagwan BC, Honorable Vice Chancellor, RGHS Bengaluru, to address the gathering. So we look forward to your inspiring words.
Good morning, everyone. Dignitaries on the dais, off the dais, my dear students, and all the honorable guests who have come across from India and abroad. It's a privilege and an honor to be here today as Vice Chancellor of Rajiv Gandhi University of Health Sciences, BVV Sanghas Medical College and the institutions, more than 170 institutions today, is a feather in the cap for Rajiv Gandhi University of Health Sciences because of the true visionary leadership of Sri Charanti Mad. Time and time again, he is proving that he is going to develop the education system and attract all the students across the country from outside also to this part of Karnataka, who was less known earlier days for its education. And today, more visionaries and politicians like him are giving importance to education. That's the best part. And health education has really grown. I was just talking to him. We had very few colleges in North Karnataka. Earlier, when we started the university, we just had about 40, 50 institutions in this part. And today, we have a large number of institutions, group of institutions, and all the local students are benefited. Especially in the field of nursing, it was a social stigma. It used to be a social stigma. We hardly used to get our own students locally to get into the nursing training, even though it's such a noble profession. And today, everyone has realized that it's part of the treating team, and without nursing team and nursing help, it's not possible to run the hospital, treat the patient, treat the human. So more and more people are getting into the courses locally, our own people, more people from Karnataka, and it's a very, very happy situation for all of us. Dr. Dilip Kumar, whom I know for a long, long time, is an evergreen president of Indian Nursing Council and iconic figure. And I'm sure he should be continued for some more years for the yeoman service that he has rendered, the policies that he has made, the changes that he has brought in the curriculum, the recognition that he has got for the nursing education in the outside countries, and now he's been elected to the council. I'm sure he would become president, secretary one day of the International Council also with his services. And I should be personally thanking him for the kind of policies and the curriculum we are imparting in the university because of the Indian Nursing Council, especially in the field of research in the last few years, collaborative research and programs. Today, he has given us one more opportunity for our nurses to be trained in the field of skill and simulation. Everyone earlier explained how it's important to have skill labs and skill training and simulation methods. And because of Sri Veeranacharathi Mat sir and also Dilip Nadekar, I think he has chosen Bagalkot instead of Bangalore or other places as a second center in India. I really envy you, sir. Had I knew, I would have requested him to start it at Bangalore. Anyway, I assumed office a little later. It's never late. We need more and more simulation centers and skill labs across the state because we have more than 700 nursing institutions as BSc and postgraduate courses, and probably more than 600, 700 the diploma courses in the state, and we are one of the largest in India, to give nursing education, and that's how it has become popular. Luckily, we have our own Dilip Kumar sir, who is there. He's from Chittadurga, hails from Chittadurga, and he has helped Karnataka grow in this field. I'm thankful to him on behalf of Karnataka University of Sciences. All the other dignitaries are there who put in their efforts, and as a surgeon, I am very well aware of what simulation means to anyone doctor who gets trained. It gives a very free area, a fearless field, and allows you to repeat mistakes and makes you learn, and then it is audited. Then the certification is given based on how I perform and when I am perfect. As a surgeon, I need to be number one, fearless, number two, flawless, never can do mistakes, and number three, it should be a perfect one. Repetition always leads to standardization of the procedure. Dr. Dilip Kumar explained to me each and everything when we went through the lab, right from the first step to the last step we climbed down. The best part is that they have given a very good finishing touch. From the reception, briefing and debriefing area till the cafeteria and the hostel. The facilities are excellent and really mindful and thoughtful. And if somebody walks into I think it's going to benefit more teachers than students first to get training, and then they can disseminate this training. So each teacher, each student really feel that from it's like totally an institute inside. From A to Z they can learn, and when they come out they'll be really competent. The world is about competitive teaching and learning, whether it's medical side or paramedical or nursing. So every hospital today are looking at people who are trained. He was just mentioning me, people who are trained from the Delhi center they are in great demand everywhere. They are just welcomed with red carpet. So also is going to happen with the Sajjal Sri Institute. The students passed out from this institute will be definitely required by every hospital, and you have that benefit and the credit. So I again thank people who took initiative, Dilip Natekar, Charanti Mat sir, and Dilip sir, and all, of course, from Laudel and the technical part, Japigo, right? Japigo, yeah, and all the dignitaries who have come from outside to train and make you learn. Hope you will have a wonderful stay here and learn the best skills possible for the medical education and nursing education. And I wish you all the best, and thanks to the management for giving me an opportunity to address you and share my thoughts. Thank you very much.
Thank you, sir, for your insights and well wishes. We now have the privilege of welcoming our international speaker, Ms. Karen Hamilton, founder and CEO of Simcom Academy UK, to share her thoughts on this occasion.
Well, hello. I've got to start by saying I'm a little unsure what time it is and whether I say good morning or good afternoon or good night. But we will get on to that in due course. It really is a true honour to be here with you today. I am here amongst distinguished and honoured guests. So, our distinguished guests on my left you've already met, I would like to refer to now. It's the leadership of Dr. Virana Charantamath. It is truly a privilege to stand alongside you on this important occasion. It is also an honour to stand alongside Dr. T. Dilip Kumar, President, of course, of the Indian Nursing Council. It is through his encouragement and strong belief in simulation-based learning that has given birth to this extraordinary simulation centre. Additionally, it is for me a pleasure to meet Dr. Bagan, BC, Dr. Kamalesh Lalchandani, and of course, I would like to congratulate Mr. Ashok Sajan and also Dr. Dilip S. Natakar. They have enabled this platform to transfer nursing education. Finally, it is a true pleasure for me, and my thanks go to the team of J. Cargo, and we cannot forget the Laerdale team. The whole team of Laerdale, including Mr. Sanjeev Singh and the other members of the Laerdale team, too numerous to mention, but they are the ones responsible for getting me here today. So, as already mentioned, my name is Carrie Hamilton, and I am a nurse. It took me 6 visa applications over the last 6 weeks to get from the United Kingdom to here right now. That's 5,000 miles away. I might also add at this point that I am dressed in a dress and wearing shoes that were purchased at 10 o'clock last night. My suitcase, full of every dress and pair of shoes possible for this event, are sitting in a suitcase at Delhi Airport. So thank you. Any compliments to my attire, well, they're just newly acquired. I'd like to give you a very brief overview of my pathway, which may help to contextualize things. I'm not here by myself as an international speaker. I'm accompanied by Laura Pham Schmidt from Singapore and James Naismith from Australia. We will be taking the stage later this afternoon and will be with you for the entire weekend. So, I'm a registered nurse in 3 different countries. Yes, I've been an international nurse in 2 of them. So I sat my RN exams in the UK and then my NCLEX exams in Canada and in America. I've worked as a med-surg nurse in emergency departments in the UK and Canada and in the United States and in intensive care units in all 3 countries. I've also worked as an expedition nurse in Africa and in in-flight medicine and tropical diseases. Across all these settings, people have needed to feel understood, supported and safe. That theme continues in my simulation work. I share this with you now to show that my roots in clinical care and simulation, they work in parallel. Alongside clinical practice, I moved into academia and was a senior lecturer at a university in the south of England, and I guided that faculty at that university through accreditation, which I'm going to move on to. For many years, I've been an executive board member of ASCI, which is the Association of Simulated Practice in Health. So I was a board member and I'm now part of their accreditation and standards committee. I've also supported our equivalent of the Indian Nursing Council, which is the NNC, with an understanding of some areas of simulation methodology. And those areas are areas where we absolutely mustn't forget that at the centre of everything we do is a person. It is a patient and it is their relatives and carers. And that is what I work very closely with the NNC to understand. So, in other ways, I'm an entrepreneur. I founded the academy where I'm director 10 years ago. And the great thing about that is that it enables me to work with many different universities and many different healthcare organisations. So I have seen and worked in and guided faculty and taught students in a whole breadth of organisations. So on that note, it was a true pleasure to see your simulation centre and how it compares very favourably with all those that I have seen and worked in. Our driving belief in the UK is that simulation creates real impact when it honours the people involved and reflects authentic human experience. So we have technology and we have mannequins, but again, that must reflect what's happening in the real world. I know that we're quite short of time, and I'm just going to come quickly back to accreditation. Now, accreditation might be something that people here in this room want to pursue. Certainly, accreditation with the organisation I've just mentioned, the Association of Simulated Practice in Healthcare in the UK, which are guiding simulation body, offers accreditation across the globe. Indeed, there's already 3 organisations in India who have achieved this accreditation, and who knows who the 4th might be. Being accredited strengthens credibility, confidence, and professional identity. Right. 2 other things I want to mention. The guiding principle for those working in simulation in the UK is our Nursing and Midwifery Council, the NNC Code of Conduct. Every registered nurse in our country works under this code, including, of course, the many Indian nurses in the UK that I've had the privilege to work with. So, I'm now moving on to say, once again, my absolute delight and pleasure with regard to being here today. Arriving here at 5:30 this morning after a 7-hour car drive is quite memorable, to be perfectly honest with you. I've talked about guiding influences to those in the UK, and specifically to those working within nursing and those involved in simulation. From one nurse, me, to all the other nurses in this room, let's keep championing championing nurses. We can do that in part through simulation, but we must keep championing the nurses of today and the nurses of tomorrow. So actually, we can all be the very best that we can be. Thank you so much for inviting me. I'm here for the next 3 days. Thank you.
Thank you, Ms. Hamilton, and I'm sure you look lovely in that dress indeed. Today, the partners of NRSC take immense pride in honoring a visionary whose leadership has truly shaped the institution's path of excellence. Dr. Veerenna C. Cheranthimman, Chairman of VVV Sangha. Dr. Veerenna C. Cheranthimman stands as a remarkable steward of education, revered for his deep commitment to academic advancement and his unwavering dedication to community development. Every milestone achieved by NRSC carries the imprint of Dr. Veerenna C. Cheranthimman's support and foresight. His encouragement, accessibility, and genuine concern for the progress of students, faculty, and every stakeholder make him not just a leader, but a true pillar of inspiration. Today, with heartfelt gratitude that the partners of NRSC come together to felicitate Dr. Veerenna C. Cheranthimman for his exceptional contributions and for being the guiding force behind many transformative initiatives. We request Dr. Veerenna C. Cheranthimman to kindly accept this honor. Let us give a grand applause as we felicitate this visionary. Thank you, sir, and thank you to all the dignitaries. Ladies and gentlemen, I now invite Dr. T. Dilip Kumar, President of the Indian Nursing Council and Board Member of the International Council for Nurses Geneva, to deliver the inaugural address.
Honorable dignitaries on the dais, of the dais, distinguished invitees, my dear students, ladies and gentlemen, press and media, and my brothers and sisters. First of all, I would like to congratulate Dr. Veerenna Ji for taking this visionary policy decision of just I made one speech when I came to this institution. I just explained during my speech what is about the simulation, how we were able to do it in SGT University. I think I gave a little detailed explanation. And so, without going into the details and also without going into the many of the discussions, in his presidential speech, he declared that whatever Dilip Kumar Ji has told, I am going to implement. That is the decision. That shows the concern and his visionary leadership, I think he's thinking another 20, 30 years, how the nursing sector is growing, how the nursing sector is being international migration which is happening, and how the government of India and the state governments are working to improve the health status of the community at large. So that decision, he took it and he implemented in totality. Rather, he has gone ahead of the SDT University. Whatever he physically visited the SDT University, and we were able to get the architect who did that, our SDT University, to bring him to Bhagalpur. All the efforts which is required, what we saw the simulation center, at least it is a everybody is appreciating, and the milieu environment for learning which is required, all the components have been addressed. Because in India, always we as sometimes the policy makers, we will always make policy statements, but to get it implemented, and many times when you put up the fight, we don't have this, we don't have this, we don't have this, all that no comes. Even for a stay no. So like that here, he has taken care of in totality if the participant comes to this for training. He has addressed the needs of the participant so that a convenient atmosphere has been created for the learning. So that I think I came to know that among the many of the medical education institutions which started, only I came to know yesterday, the nursing was the first you started IUP. So that itself shows, that itself shows how he could realize 25 years back the need of the nursing. See, he has realized 25 years back, starting the nursing, now he has landed into going the high level of training, which is not only in this institution, is not only going to be, it is going to be a path breaking for the various training programs. Now the India is going towards advanced nursing practice. In that perspective, these type of facilities are going to be more useful. So once again, I would like to congratulate you, sir, for taking this very path-breaking decision to establish this. I think we always think of why the simulation. At least I think the component which touched my heart when the Indian Nursing Council, along with the executive members, went to the Singapore Nursing Board to sign a MRA, Mutual Recognition Assessment, when we all the executive committee members went to the Singapore, and successfully, ours is the only regulatory body so far. Under the GATT agreement, you might have heard, under the GATT agreement, we have signed a lot of mutual recognition assessments with the government of India, telling to the many regulatory bodies. Except Nursing Council, nobody has signed architecture, law, and medical, dental, pharmacy. Except Indian Nursing Council able to fulfill the signing the MRA, a mutual recognition assessment with the Singapore Nursing Board. So when we went there, we saw this simulation. To tell you, my dream started since then. When India is going to have simulation like Singapore Nursing Board, where they are using the technology for the nursing. So I think I was the nursing advisor also at that time, and I was also holding the position of the president of the Nursing Council. And I am telling you, literally, I was not successful as a nursing advisor and also as a president. Could not implement that, whatever the dream I developed by seeing the Singapore, the technology of training. Only after the sometime when I became exclusively the president in the Nursing Council, so I initiated the concept and the lateral and the Japago. Japago is the I think this has brought out in such a way when we invited our Honorable Health Minister Nadaji to inaugurate our new building in the Indian Nursing Council. In my welcome speech, I said one word: Indian Nursing Council is going to have a state-of-the-art simulation center. that one sentence sent the message to the Dr. Leslie, the Japago CEO, the John Hopkins affiliated international NGO. They are working in 40 countries and including India. And they are working basically in the saving the lives is their motto. They are basically working in the maternal care and services. And the chief of the Japago is happened to be a nurse. Dr. Leslie, she is the CEO of the Japago. You can imagine the nursing students who are sitting here, some of the nursing professionals who are here, you can think of a nurse can reach up to become a CEO, holding such a very high position of the CEO, and it is not easy because to become a CEO of an international NGO where the process of getting funding from the different financial agencies, you should have a capacity to interact with the funders and partners. It's not easy. So and when the Japago was participating in the inaugural ceremony of that, the Japago officials sent a message to Dr. Leslie, who is sitting in the Maryland in USA. The Indian Nursing Council made the statement. So that within at least maybe within 3 to 4 weeks, I am getting a letter from the Dr. Leslie. Japago is going to provide technical support for the establishment of the simulation center. That's how the process started. And you know, in India, I think to any infrastructure issue comes, it is very difficult. So we were locating, we should have a very good connectivity, air connectivity should be there, we should have a good environment, all the medical colleges, educational institutions should be there. We were searching for a venue for establishing the simulation center. Fortunately, Dr. Chawla, with the managing director, owner of the SDT University, he came with some purpose of the discussion with me. At that time, I explained to him. So he also immediately agreed to have, because we wanted to have it in Delhi, because Delhi becomes easy for the connectivity and all for the country. So that's how the lateral provided the technical support. Japago support gave the technical support. Lateral also became the collaborator with us. That's how we established. And so far, we have trained about 2,000 faculty members. And I think the trainers who are training, many of the trainees also must be here. You can see they are participating in this. And we are getting very good feedback. The training, what it is going on in our STT, they are all very much impressed, and many of the senior faculty in nursing, they have appreciated the methodology which is being used there. Why the simulation? I think I would like to make for the general public to understand why the simulation started, and it's coming from the civil aviation, the pilot. The pilot who is in the aircraft is the custodian of the passenger safety. So in the passenger safety, who is having the custodian, so he is being trained through the process of simulators. Because that's how he is acquiring the competencies as a pilot through the simulation and the method which they are trained. That's how this simulation has come to. So when from civil aviation, when he is the custodian of the passenger safety, we doctors and nurses, we are totally manipulating the working with the human body, and the patient safety is the first foremost responsibility of the doctors and nurses. So therefore, I think the relevancy of the training of this the simulation as a method of teaching is more important to the health. That's how the nurses and the medical field, the simulation is came to existence. So in that perspective, that we were able to now the government of India is also realized that how important the simulation is a method of teaching. Coming to the next area, how nursing profession is placing in a role in the international level and also at the 2020. You might have remembered the 2020 the World Health Assembly. You know, the World Health Assembly means 193 countries of the health ministers, health secretaries, director generals. All these three people, each country will have at least 10 to 15 delegations, will go to the Geneva every year in the month of May to attend the World Health Assembly. Just like an assembly in the state or the parliament like that. So when they went in 2020, the Lord Nigel Crisp, who was happened to be the NHS National Health Services Secretary General. In the world, the best health services when we ask, UK is the best NHS. This Lord Nigel Crisp worked as a secretary of the NHS. He was knowing the impact and outcome it is making in the health, the contribution of the nurses and midwives. That's why when a call came in 2020 was to celebrate the 200-year birth anniversary of the Florence Nightingale. How to celebrate very effectively our 200-year birth anniversary of Florence Nightingale. So he captured the evidence globally how nurses are making an impact and outcome in the health industry. Like how the nurses are able to save the budget of the hospital, how the nurse-led clinics are making an outcome in the patient's outcomes, even how the midwifery-led units are making an outcome. All this evidence he captured. With that evidence, he went to the International Council for Nurses and also to the WHO. And Tedros being the Director General, he is a very passionate towards the nursing. So he took a very wise decision of in that World Health Assembly, declared International Year of the Nurse and Midwife 2020. This was not given to any other profession except to the nurse and midwife WHO declared. So that shows how the World Health Organization gave an importance to the nursing profession. Unfortunately, the COVID came in. So we would not enjoy the euphoria of the WHO celebration of the International Year of the Nurse and Midwife. We could not enjoy it. So therefore, but that the COVID gave an opportunity for the nursing and midwifery professionals, how this profession is so important, globally realized. I think only nurses and midwives were available. Even in India, many of the doctors, professionals came and told me that the doctor who was an IAS officer was admitted in a hospital, and he was telling, nobody came to see me, even my brothers and sisters happened to be doctors, nobody came and met me, only nurses only met me, nurses only took care going forward. So how important the nurses and midwives we could able to demonstrate in the year of the COVID. So at the same time, WHO did not sit with only making the International Year of the Nurse and Midwife with a slogan. So they came up with a strategic direction for nursing and midwifery, STNM 2021-25. They came up with a strategic direction and resolutions have been passed. And also they came up with a State of the World Nursing Report. SWORD report is called, State of the World Nursing Report. That State of the Nurse World Report captured the evidences of the nurses and midwives' contribution globally. So when they passed, they sent it to all the countries. If you see that book, SWORD report, now the second edition, in 25 the World Health Organization has released this SWORD report 2025. But the theme of the SWORD report was very important, very relevant to our India, and also for me, worked in the Ministry of Health for 30 years and also working in the regulator, it is more music to ears to me, whatever those themes. The first theme is investment. It is telling in that strategic direction for nursing and midwifery, resolution passed by the WHO, telling the countries invest more in nursing. I think I am seeing that investment what Dr. Viranadi is putting. This is an investment. He has put an investment of the what global WHO resolution says investment in nursing education. He is telling to the countries, he is telling to the institutions and to invest the money. So our Viranadi has invested the money like in terms of the relating to our resolution of the World Health Organization. The second the theme is creation of the nursing positions. Because we nurses I think realize how we study, we come out, but we don't implement the nurse-patient ratio in the hospital. In the absence of implementation of the nurse-patient ratio, quality dilutes. So therefore, this resolution says, telling the countries, create the nursing positions. The third theme is the leadership. They have got an evidence, a ward sister, a assistant nursing superintendent, or a director nursing in a hospital, she has to work for one patient with a various interdisciplinary team. So once she is working with a various interdisciplinary team, if she is having a leadership skill, then she will be able to make an impact outcome in the patient outcomes. So they have got an evidence the nurses need to be trained in the leadership. So that's why the Indian Nursing Council has brought the state-of-the-art leadership for change, LFC. It is also about 50 countries, and India was the latest country. We were able to after the China, because when I went and saw in China, the LFC program is going in a big way in China. So we thought, why can't we? India should not be left behind. So we have brought an LFC program. We have trained 40 people in that LFC program. This leadership for change training program is not like only theoretical. So it gives a how in a ward, if you have an infection is a problem, how with the leadership skills you can reduce the infection rate in a ICU or in different units. So that is the leadership for change. So that concept of leadership for change has been brought into India. We have trained 40 people, and those 40 people are going to further training and in the leadership. So that is again aligning to the theme of the World Health Organization. The last and very important theme is service delivery. In this service delivery, they have included the working conditions, because this is very important, the salary and the leaves, and also the important component of the equipments and supplies which are required for the nurses to work effectively. So it covers gamut of all these issues. Now the Ministry of Health is working on this issue, how best we can translate these resolutions passed by the WHO. Now the universal health coverage, you know that which is very important with the United Nations has passed a mandate. The India is a signatory for the universal health coverage, and WHO has said if no nurses are there, you can't achieve the universal health coverage. So therefore, the WHO has taken another policy decision that the universal health coverage, which was supposed to be the strategic direction for nursing and midwifery, is supposed to be implemented by 2025. They have extended another 5 years. WHO has extended 5 years time. That means by 2030, you have to achieve these strategic direction for nursing and midwifery. So therefore, the World Health Organization is putting more effort to the countries for implementing this own report and the strategic direction nursing and midwifery, ultimately will to impact and outcome for the reducing the infant mortality and also improve the quality of health of the people. So in that perspective, numbers becomes very important, because you need a country requires the numbers. So therefore, the Indian Nursing Council, when the Parliament asked the question, how many nurses are there in India? We simply not only Indian Nursing Council, the Pharmacy Council, Medical Council, Dental Council, we give the statement, we don't say how many are there. We will say 39 lakh nurses have been trained from 1947 to date. We very clearly say so in the 39 lakhs, how many people have died? How many people are sitting at home? How many people have gone abroad? You don't have a data. So once you don't have a data, everybody is very happy. 39 lakhs means parliamentarians and all will be very happy. You have so many nurses. But yeah, at least while working in the ministry and the president, I realized we are not having a realistic, reliable data. In the absence of reliable data, you can't have an effective nursing manpower planning at the state level or at the national level. So therefore, Indian Nursing Council took a very important step that developing a live register. It's called Nursing Registration Tracking System, NRTS. So in this NRTS, what we have done is, it is linked to the Aadhaar. So it is linked to the Aadhaar, which is a unique identity of the country, and which is linked to this Aadhaar. And we have, the way the Aadhaar was developed, similarly, we went our team to each hospital, each clinic, each nursing home to capture the data. Data means including their photograph, their educational qualifications, and also the which council they have registered. So all that we have collected. So now we have 13 lakh nurses. The data we are having in the nursing registration tracking system. But again, this 13 lakhs, in my opinion, it is not 100%. Still, many of the states require to be. Some of the states have achieved 50%. Some of the states have achieved 60%. So what we are now, the many people, to give one example, why we could not do it 100%. Some of our nursing and midwifery professionals sitting in the regulatory bodies, telling the policymakers, in their act, the word maintenance of the nurses in a digital format, the word digital is not there. So that is the rationale they are giving to the policymakers. Therefore, they are not doing that NRTS. Who was knowing in 1947 the computers are going to come in India and all the things are going to be done in India? Nobody was knowing at that 1947 when the act was made after the independence. So that's why at that, but in India, it's always anything come with a policy planning from the top level. We only know how to legally, you can say that I don't want to do it, but they will give these type of excuses. But the new Nursing and Midwifery Commission bill, which has been approved and is coming shortly, in that we have ensured that the India is going to maintain the nurses in a digital format. So that means you have to, there is no choice. There is no choice, you have to have the data. So once you have this data, you have a very good planning, like for example, 13 lakhs, what we have captured. In that, auxiliary nurse midwives are there about 2.99 lakhs. General nursing and midwifery people about 6.70 lakhs. And BSc nurses qualified and registered as 3.34 lakhs. So that means you will be able to make out how many diploma people are there, how many degree people are there, how many qualified in different specialties. All that data you can have once you have this registry. So once you have this registry, I think during COVID, I remember one of the IAS officer was asking us, can you have a district wise data? How many nurses are there in particular district with their qualification? We were not having. So then even the private staff is at that time, we tagged this NRTS, we could have only. But in this new NRTS, if you type Bagalkot, in that Bagalkot, you will be able to get how many nurses are available in this Bagalkot, along with their qualification, along with the specialization will come. So then it becomes an effective, and also any new private hospital which is coming up, they will be able to access the data to whom they can appoint. Now the process of the simulation center, which is the plus we have added to this Bagalkot simulation center is assessment. Once we have the assessment and certification, that becomes easily anybody can access. Oh, this person with this qualification, they have this assessment, they can appoint. So that type of qualitative assessment you will be able to get before taking a decision for appointment of the nurses. So therefore, this again we also wanted to give a unique data, so that with that data they will be able to make it important. So now once we are going with this process of a number of nursing educational institutions, where are we? India among the globally in nurse population ratio, where are we? Like Finland. Finland is the country which is the highest nurse population ratio. That means 22.3 nurses for 1,000 they are available in Thailand. In USA, 12.5 nurses per 1,000 population. Canada, 10.3 nurses per 1,000 population. I think these are all developed countries. So let us see my neighboring country like Thailand in our Southeast Asia. Thailand is the one basically, at least in nursing, they are doing much better than India. So even the Thailand, the nurse population is 3.1 nurse per 1,000 population. The Sri Lanka, 2.4, whereas India, 1.7. You can imagine we are top of the below compared to the nurse population. What WHO is telling? WHO is telling you should have 3 nurses for 1,000 population. So we have 1.7. If you make a realistic assessment of this 1.7, again is not a reliable data. Because the reliable data, because I have told you that many of the people have gone abroad and all. So now, recently, International Council of Migration has come up with the data. So this International Council for Migration, they are telling that India is the number one is the Philippines, but number 2 is the India. Again, and the number 2, though they have told the India is the highest, number wise, they have compared between the nurses base level 2020 and 2025. They have compared 20 years, they have taken a period to assess the international migration. In this 20 years, we are 425% migration has taken place, whereas Philippines, they have taken 147% with base figure of the 2020. That means they have quoted 1,22,400 nurses have migrated to the OECD countries. You know, these OECD countries means only about 25 countries are there, not all the countries. When Middle East has been left out. Middle East is one of the very important reasons where our nurses are going to the to work in the Middle East, and many other countries are left out. So that means even the migration, which is the way they are going. So we are in the future, we are going to be the number 1 nurse globally. Migration is going to take place from India because of the large number. Even the International Council for Nurses has made an estimate 5.8 million to 6 million is the shortage of nurses by 2030. That is the figure the International Council for Nurses has made an assessment that the shortage, global shortage of nurses are going to be 5.8 million to 6 million. So you know the numbers, global shortage of the numbers. Which are the countries are there to produce? Only I think Philippines is having a policy of paying the for abroad, but India is the only country available for the nurses to work at a global level. And the reason is we have Indian Nursing Council has taken some of the policy measures, making this competency-based curriculum. The competency-based curriculum, the recently Indian Nursing Council has revised the curriculum. Simulation and skill labs are made very important in the day-to-day training program. So therefore, the once if you have to train more people with a qualitative period, qualitative nursing professionals need to be trained. You need different technologies to address this quality, and simulation is one of the best solution. And where now need of the hour in the medical education, simulation is the best investment which has to be. So in that perspective, this institution is going to play a very important role in the future nursing education. I think the nurse practitioner, which I think many people may not be knowing. So the Ministry of Health also has given a more scope and more support for training the nurse practitioner. We have a 12 nurse practitioners programs we have been developed, and the important thing is nurse practitioners critical care program we have started, and 62 institutions which are running this critical care program. To tell you, many of the intensivists have told us during COVID period, many of the nurse practitioners, critical care trained people, they came to handy in the COVID time. Recently, we organized some sort of feedback for the nurse practitioner critical care program along with the intensivists, because always we nurses, we may say that this program is good. No, we called the intensivists to get the feedback about the nurse practitioner. Intensivist told us, one of the intensivists got up and told, sir, if I have a doctor told us, if you have a during night duty in ICU, if I have a nurse practitioner critical care, I will have a good sleep. If you have a The doctor is there in the ICU, I have a concern. So this is the statement made by an intensive. So therefore, to maintain effectively the quality of the ICUs, we need more nurse practitioners, trained people. So now we have reached a stage, these nurse practitioners in developed countries like in America, a staff nurse, a clinical nurse, the highest qualification they can think of is Doctor of Nursing Practice. It's called DNP. So many of these staff nurses working in clinical level, because the PhD in education course, but for the clinical nurse, they are DNP. I am giving an example. One of the doctors told me from India, who is coming working in America for 15 years, he wanted to come back to India. Before coming back to India, he wanted to try his luck to become a CEO of one of the hospitals in America. So he applied for a CEO post in America, and when he went for an interview, he could not be selected, whereas one nurse with the DNP qualification was selected as a CEO. So that is the level of so that program also we have brought to India now. We have started on a pilot basis in a Mahatma Gandhi Medical College in Mumbai, Krishna Institute of Karate. We have started on a pilot basis with the collaboration of the University of Houston. We have started this DNP program. I think lastly I would like to make the one more indicator I wanted to give before that. Where are we? Because India is also producing, I think Gurunaji knows, because the Arabic Medical College also. And just for the sake of where are we in a doctors and nurses ratio, where the India is standing global. So the population nurse physician ratio, WHO says one doctor should have 3 nurses. That is the norm. The WHO international norm is for one doctor you need 3 nurses. In Japan, 4.6 nurses for one doctor in Japan. In USA, 4.1 doctor for one nurse. No, 4.1 nurse for one doctor. Canada 3.9 nurses. UK 2.8 is the latest the WHO figures. India where are we? 1.9 nurses for one physician. Whereas we should have 3. So that means even in 1.9 I am telling you that data is not reliable. Even the data what we have base data itself is not reliable, 1.9. So if you have a 3 nurses for one doctor, still a long way, even India, to reach that international norm. So therefore, I think the policymakers now realizing that is the reason India is now pushing for in terms of the investment, the government of India recently sanctioned 157 nursing colleges with the co-location of the medical colleges. That is, in that way, the Ministry of Health is investing in terms of the opening the more nursing colleges. I think finally I would like to end with some 10 points which are very relevant. The International Council for Nurses has given a charter of change. Charter of change is very important and it is relevant for all the countries, and they are telling all the countries to work on this 10th charter of change. One is protect and invest in nursing profession. This is the first charter they are telling to the countries. Second charter is safe and healthy working conditions need to be provided to the nursing professionals. The third charter, recruit and retain. Because it's very easy to recruit. Retention is a big challenge. To retain people is a big challenge unless you don't plan it properly. The fourth problem of the charter of change is the finance national nursing work plan. Because the work plan means you can see that 1.9 for one doctor and 1.9 for the density is also still we are very big. So a country plans for the nursing workforce planning. For that they are telling that a country should invest money for the nursing workforce plan. Then number 5, invest in nursing education. This is one they are telling to the International Council for Nurses. And again it is telling full scope of practice. What the nurses are trained, they should be allowed to practice while working in a clinical setting. Because they are trained more, but they are not fully utilized in the clinical setting. So therefore, they are asking all the countries full scope of practice. So this issue is being addressed in our new Nursing and Midwifery Commission. The present Indian Nursing Council Act is not addressing about the scope of practice. In the new Midwifery Commission which is coming up, which is having a power for the Nursing and Midwifery Commission to decide about the scope of practice. Then recognize and value the nurses. That is the 7th, the skills and knowledge and attributes and expertise to be utilized at the 8th. 9th is the engage National Nursing Association. The stakeholders of the nursing professionals need to be engaged in the policy making. Respect human rights. That is another, and also appoint more nursing leaders. These are the 10 charters of change the International Council for Nurses is telling to the countries. I think all the policymakers have to keep in mind these 10 charter of charges, changes which the ICN is giving. If you are able to implement these charters, definitely there is going to be an impact and outcome in the patient outcomes, quality of the patient's care will improve, and the human rights issues, some of the issues which are there, is also going to be addressed. So once again, I would like to thank the organizers for giving me this opportunity to share my thoughts, and also taking this big initiative of establishing the new the National Referral Simulation Center with the added component of the assessment and the certification. And I wish best of luck to the new institution, and also I will wish the trainers who are going to work big luck, and also the 2 days simulation, some conference which many of the nursing professionals are going to participate, including the teachers from the STP, is going to be definitely benefiting to update their knowledge and skills with the international expertise which we have got in. They will be able to get an opportunity what is happening in the simulation at global level, how some of the practices which we are doing needs to be corrected. So these 2 days the training is going to make an impact and outcome. With this, wish you best of luck. Thank you very much.
Thank you, sir, for your informational address. The rest of the presentations will be resumed in the evening at the boardroom of Sajjashri Institute of Nursing. Ladies and gentlemen, with great respect, I invite Dr. Veerana C. Charanthambut, Honorable Chairman DDV Sangha Bagalkot, the stalwart of vision and commitment, to share his presidential address.
Sajjashri Institute of Nursing Science, inaugural ceremony of National Reference Simulation Center and Competencies Certification Center and 3 days international sun conference already inaugurated. Respected Dr. T. Dilip Kumar, President of Indian Nursing Council, respected Chief Guest Dr. Bhagwan, DC, Honorable Vice Chancellor Rajiv Gandhi University, Health Science Bangalore, respected guest of honor Dr. Kamlesh Lal Chandani, Deputy Country Director, Chicago, New Delhi, and Sri Sanjeev Singh, Managing Director, Lauderdale Medical Private Limited, New Delhi. International faculties, Harry Hamilton from UK, Laura Thom Schmidt from Singapore, and James Naismith from Australia. Respected Mahesh Shatani, Ashok Sajjan, and Vishwal Dilip Natikar. Honorable members of BBB Sangha, distinguished guests, esteemed nursing leaders of India and abroad, faculty members, invitees, media persons and dear students. I extend my warm greetings to all of you on this historic and proud occasion as we are inaugurated India's second National Reference Simulation Center and the Competency Certificate Center at V.V. Visenga's Sri Institute of Nursing Science, Bangalore. Nursing is the heart and strength of our healthcare system. Without skill and confident nurses, hospitals cannot function effectively. Skilled nurses reduce errors, protect patients, and make healthcare trustworthy. We have witnessed the courage and dedication of our nurses during the COVID-19 pandemic. The idea of establishing a simulation center took birth when Dr. T. Dilip Kumar visited V.V. Sangha during previous conference. His encouragement and strong belief and simulation-based education inspired us to dream big. His guidance became the driving force behind creating this world-class center. Today we are proud to see that dream turns into reality. We are deeply grateful to the Indian Nursing Council for providing technical support and guidance. We are grateful to Jipago and International NGO for its expertise and dedicated partnership in building this center to international standards. We are honored to have a person like Bhagavan, Vice Chancellor Raghu, as a chief guest. I am grateful to Kamlesh from Jipago and Mr. Sanjeev Singh from Narodal Medicals for their presence and for the support they rendered throughout the journey of this establishment. Our Sangha has invested 16 crores in this simulation center, which I believe is our commitment to quality education. This center is not only Bagalkot or Karnataka, it is for the entire country. It will train the students, empower practicing nurses, and strengthen healthcare service across India. Dear nursing professionals and students, the center belongs to you. Use it fully, practice without fear, learn the dedication, grow with confidence. Let every moment here prepare you to serve patients with compassion, skill and humanity. With great pride, joy and gratitude, I dedicated the National Conference Simulation Center Competency Certification Center to the students, faculty, nursing leaders and the healthcare community. Thanking you all.
Thank you, sir. We are honored to listen to your thoughts. Ladies and gentlemen, as we draw this memorable event to a close, it is said that gratitude turns what we have into enough and more. It transforms gatherings into memories. In that spirit, I now invite Dr. Sriharsha C., Professor and Head of Department of Psychiatric Nursing, BVDS, Sajjala Street Institute of Nursing Sciences, to deliver the vote of thanks.
Ladies and gentlemen, a very good afternoon to all of you gathered here. As we come to the close of this historic and proud occasion, the inauguration of National Reference Simulation Center, the Competency Certification Center, and the International Sun Conference, it is my humble privilege to propose the vote of thanks. Today will remain etched in the history of V.V. Sangha and in the future of nursing education in India. This milestone would not have been possible without the blessings, presence, guidance, and contributions of many distinguished individuals. First and foremost, on behalf of National Reference Simulation Center and Sajjala Institute of Nursing Sciences and everyone gathered here, I express my deepest gratitude to Dr. Veeranna C. Chattimal sir, President of today's function and Honorable Chairman of V.V. Sangha. Sir, your visionary leadership, your commitment to education excellence, and your unwavering encouragement have transformed this dream into a magnificent reality. Your guidance continues to inspire generations. Thank you, sir, for gracing this function, your esteemed presence, and for the foundation of this achievement. My heartfelt thanks to Dr. T. Dilip Kumar, sir, President, Indian Nursing Council, New Delhi, and board member, International Council for Nurses, Geneva. Sir, your lifelong dedication towards strengthening nursing education in India, your push for competency-based curriculum, and your constant support to institutions across the nation have uplifted the nursing profession. Uplifted the nursing profession beyond measure. Your inspiring words today will motivate thousands of learners and educators alike. Sir, we are sincerely grateful for your presence. Thank you very much, sir. A special word of gratitude to Dr. Bhagwan BC, Honorable Vice Chancellor, Rajiv Gandhi University of Health Sciences, Bangalore. Sir, your academic leadership, innovative reforms have strengthened health science education in Karnataka. Thank you for your gracious presence, constant support, and belief in nursing fraternity. Thank you very much, sir. I extend my heartfelt thanks to Dr. Kamlesh Lalchandani, Deputy Director, DEPAGO, whose global expertise, collaboration have contributed immensely to the center's development. Thank you, sir, for your presence. My sincere appreciation to Mr. Sanjeev Singh, Managing Director, Ladle Medical Private Limited, India. Your organization's cutting-edge simulation technology and professional support have played a vital role in shaping this world-class facility. Thank you for your valuable partnership and your inspiring message. I am deeply thankful to Sri Mahesh and Athani sir, Honorable Secretary B.V. Sangha, and Sri Ashok M. Sajjan sir, Chairman, Governing Council, Health Science Institutes of UV Sangha. Your continuous support and guidance strengthen your endeavor, every endeavor of our institutions. Thank you for your esteemed presence today. A respectful note of thanks to Dr. Reddamma Madam, Nodal Officer, National Consortium for PhD Nursing, Dr. Manju Aksa Madam, former Principal, AIMS New Delhi, Executive Committee members of Indian Nursing Council, Mrs. Lal Biak Sanghi and Mrs. Sunita Chaudhary. Your presence has added immense value and pride to this ceremony. Thank you very much, both of you. I wholeheartedly thank Colonel Dr. Sarvajit Kaur Madam, Secretary, Indian Nursing Council, Dr. K.S. Bharti Madam, Senior Consultant, INC, and Sri H.M. Reddy, Senior Consultant of INC, for honoring us with your presence. Thank you, all of you. Our gratitude extends to our international speakers and national speakers, Madam Carrie Hamilton from UK, Madam Lara from Singapore, Mr. James Naismith from Australia, Mr. Alvington from Australia, and Madam Princey from Ladle, India. Your presence symbolizes global collaboration, academic excellence. Thank you for enriching this event. We are honored by the presence of Srimati Lokam Sikwa, Registrar and Secretary of Arunachal Pradesh Nursing Council, and Madam Fluffy, Registrar of Goa Nursing Council. Thank you for your presence today with us. A sincere thanks to Sri Samir Kumar Jena, IAS, for your presence. Thank you for your presence, sir. A very special and heartfelt mention to Sri Mahesh and Kakredi sir, Chairman, Building Committee, BV Sangha, and his entire team. Sir, it is because of your timeless efforts, unwavering supervision and commitment to the excellence, this state-of-the-art world-class simulation center has come into the reality. Thank you, sir, for your team and yourself. I also extend a warm and sincere thank you to Sri Ashok, sir, convener of our automobile department, for coordinating transportation of all our guests. Thank you very much, sir, for you and your team. I extend my heartfelt thanks to members of UV Sangha, whose dedication and commitment continue to guide and strengthen every endeavor of our institutions. Thank you all respected members of UV Sangha. On behalf of organizing committee, faculty, students, I extend heartfelt gratitude to Dr. Dilip S. Natekar sir, principal of our college, for his unwavering support, guidance, and vision. Thank you very much, sir. A special word of gratitude to principals of our sister institutes, Madam, Elamani Madam, and all other principals who have come and witnessed this occasion. Thank you all for your presence. I also express my heartfelt thanks to media friends. Your presence and coverage help to take the message of this proud milestone to the larger community. We deeply appreciate your continued support. I thank all the state and national leaders of nursing who have gathered here and witnessed this milestone. Thank you, all of you. I thank organizing committee, technical team, volunteers, administrative staff. Everyone worked quietly behind the scenes. Your dedication, tireless efforts ensured this success to the grand reality. Thank you all. I convey my special thanks to my faculty members because they stood behind us. They worked day and night and made this possible. They made this event possible. Thank you all of you. Thank you all of you for your dedicated efforts. Today, we celebrated not just an inauguration, we celebrated a vision, a commitment, a promise to prepare skilled, compassionate, and globally competent nurses who will shape a healthier tomorrow. As we move forward, let us carry the spirit of learning, service, and excellence that is central stands for this. On behalf of Viva Sangha, Surgical Assistant of Nursing Sciences, I extend my deepest gratitude to each one of you gathered here. Thank you one and all. Have a wonderful and inspiring day. Thank you all.
On behalf of everyone present, I extend a heartfelt thanks to Dr. Sriharsha for being an integral force in the seamless execution of today's program. Ladies and gentlemen, may I now request all of you to kindly rise for the national anthem. I kindly request all delegates